Hey everybody, it's Jeff Morin from Urgent Response, and I just wanted to welcome you to our BLS Healthcare Provider course. We're going to cover all the information for adult, infant, and child CPR, rescue breathing, airway obstruction techniques, and using the AED. We'll cover that for the infant, birth to 1, child, roughly 1 to 8 years of age, and then 8 years old and up for the adult. A lot of the times between child and adult, we're really focusing on the difference in their size. So a lot of times anybody under 80 pounds is the child, over 80 pounds is the adult. So that may include having a large child that we do adult skills on, or a small, let's say elderly patient that we're going to do child skills on. So it can go either way. So a lot of times the best judgment is on the patient's size. So now it's important that when we're talking about CPR, the best results are when we follow the chain of survival and we do it as fast as we can. So that's early recognition of an emergency, early access into the 911 system, early CPR, early defibrillation, and then advanced life support, which is either the paramedics arriving on scene and starting the treatment of the patient at the advanced life support level, or arriving to the emergency room. So that's the chain of survival. Really, we need to react fast. So if time goes on, within 4 to 6 minutes, brain cells begin to die without oxygen. And in 10 minutes, the person could be completely brain dead. So we always talk about first responders and EMS and that. And of course, that's what we fall under as the BLS healthcare provider, but it's really the bystander that saves the patient's life, because if the bystander doesn't start CPR, the patient really has no chance whatsoever. So, 4 to 6 minutes without that oxygen, brain cells begin to die. 10 minutes, the person's completely brain dead. So most of the times when we're waiting for an ambulance to arrive on scene, a lot of times they'll say 6 minutes out the door, but there's a lot of other factors that we have to put into place. So definitely it's easy for 10 minutes to go by and that person, if they're not getting bystander CPR, becoming completely brain dead. The only time you have more time to work with is if you're in a cold environment. If we're out in the cold, brain cells tend to last longer, so that patient's not dead until they're warm and dead. So if we had somebody out in the cold, we're going to slowly rewarm them and do CPR as we're doing that. And a lot of times they have a better chance of survival because of the cold, as I said, preserving the brain cells. So going back to the second part of the chain of survival, as soon as we come across an emergency, if we're by ourselves with an adult patient, we should call for help first. With pediatric patients, call as fast as we can. So a lot of times with adults, we're doing those skills right away. Or actually we're calling for help right away and then doing the skills as quick as we can. With infants and children, we want to actually provide CPR and then call for help. I mean, if you got the phone right there with you, then you should, call for help at the same time that you're providing the skills. But when we talk about infants and children's and what causes their deaths, it's usually a preventable accident that's most likely a respiratory emergency, which could be suffocation, could be any type of suffocation, airway obstruction, most likely a respiratory problem. So children have a better chance of bouncing back than adults do. Adults often will need to have some advanced life support. So a lot of times it's more likely cardiac related. So we want to make sure that we recognize that emergency as quick as possible, call for help. Now when we call for help, the most important thing to tell the dispatcher is the location of the patient. Not where you're located, which may be the same place as the patient, but where is the patient? So they say 911, where is your emergency? So I want to give the street address of where the emergency is. When you're giving the street address, it's important to give the city and state as well. In some locations, like where I live, it's by the water. Across the water is another state. So it could be, like we're in Rockport, Massachusetts, but my call could skip across the water, especially if I was in the Ipswich Bay, right in the water. It could go up to Seabrook, New Hampshire. So I could hit a cell tower in Seabrook, New Hampshire, even in Maine. So we want to make sure that we confirm the address with the dispatcher, and that way we can get a response there as quick as possible. They also want a callback phone number. So if for some reason you get disconnected, they want to confirm the number that they see on the screen is the correct number to call you back, especially with some healthcare providers. They may be using a company cell phone. That company cell phone may give a different callback number on the screen. So dispatch wants to confirm the number that you're calling from so they can call you back directly. We also want to know the age of the patient. It's so important to know the age of the patient so the rescuers arrive with the correct equipment. So we want to make sure we get the specific age or as close to the specific age of the patient so we arrive the first time on scene with the right equipment. Brings me back to a call way back, and I tell the story time and time again, but a woman called and said, my baby's not breathing. When we arrive on scene with all the pediatric equipment for a baby call, it turned out this little elderly woman who's yelling, my baby's not breathing, has a 40-year-old unresponsive diabetic son on the floor. At that point, one of us has to run back to the ambulance, get all the correct equipment, and then get back to the scene. So we want to make sure we have all the appropriate equipment right off the bat. So age is important. The other thing is to know what's wrong on scene, and what's being done for the patient on scene. So with that, if it was my spouse is not breathing, they don't have a pulse, okay, they're in cardiac arrest, is there CPR in progress, was there an AED on scene that was being used, that's all good information to pass on. It could be a first aid situation where somebody has just fallen, but we'd want to know, okay, if that person has fallen, are they still on the floor? Did they lose consciousness? Or are they back in bed and they're fine, they're alert to person, place, time, and event? Like at that point we know that, maybe they didn't whack their head so bad. But sometimes we also want to know, especially with patients on blood thinners, we would want to know that, is your family member on blood thinners? Because if they whack their head, they could have an internal head bleed. So there's a lot to think about there. But it's important to react as quick as possible given the location of the patient, a callback phone number, their age, what's wrong on scene, and what's being done for that patient.